a 2008 graduate, and I'm also a graduate of Strathmore Business School, so MBA Healthcare Management. I work for inSupply Health as a senior advisor, market development and partnership. And since we've been mentioned so many times this morning, I'm honored to just give a quick snapshot of who inSupply Health is. Next slide, please. So inSupply Health is a John Snow Inc. affiliate. We are an East African health advisory firm who also does consulting. And we are basically pioneering innovative approaches to improving health outcomes by health system strengthening, focused on supply chain. As the slide says, our mission is to transform lives by co-creating innovation and sustainable solutions together with the communities. And our vision is to empower communities to take care of their own health priorities, mainly focused around supply chain, but we are also seeing how to expand based on community needs. Next slide. So we currently have offices in Nairobi and Tanzania currently, but we have a very strong association to John Snow Inc. In Washington, D.C., who are currently owning the organization fully. So as I mentioned, we are an affiliate of John Snow Inc. We also are partners with Partners for Supply Chain Management, which is an organization based in Netherlands. And what this has enabled us to do is that being a startup organization that just started in 2018, we are able to leverage and benefit from a global experience and also support with things like accountability, transparency, and integrity, as mentioned in the morning. Governance and leadership is also supported from the global organization. Next slide. Next slide, please. So basically, our two key strategic priorities, and I want to highlight this because why inSupply Health was formed is to reimagine technical assistance. As you heard from the Dean of Strathmore Business School today, the mindset that we have always been told is that we are third world and they are first world. But what we're trying to do as inSupply as well is changing our mindset that support, technical assistance, and all the other activities that have been supported traditionally from developed countries like the US, the Western countries. Most of those people have been the ones implementing the technical assistance and supporting in our continent. What inSupply is trying to do is create an organization that is locally led, locally equipped and locally skilled to support this technical assistance and to also to offer jobs. And because we also know where the shoe hurts, we are able to better utilize some of the resources and finances that come with technical assistance. So our strategic priorities is that we are looking at advancing sustainable health to be a sustainable health advisory firm with an annual revenue of about $5 to $6 million, with a diverse portfolio of funding and projects that reflect our core strength and multi-talented team. So historically or traditionally, we've mainly worked in public health, but we are currently trying to get into the private sector. Given also the numbers today morning is that, you know, as a growing economy, low middle income, moving to middle income, there's so much opportunities in the private sector, and that's where also inSupply is trying to tap into. We also would like to be associated as a learning organization committed to generating knowledge and applying innovation to address the evolving needs of end users. This is our patients and our communities. And when we say a learning organization, we mean both internally and externally. So we are really focused on projects where we are also supporting pharmacists and other healthcare professionals to offer healthcare solutions for the future. So as I mentioned, reimagining technical assistance. This is our team, almost 100% all local people, both from Nairobi and Dar es Salaam. Next slide. And this is just a quick snapshot of our leadership team. We are a women-led organization, and we are really focused on equity, gender, and participation of the youth in terms of our setup. Next slide, please. So our clients, this has been our clients, and we're looking to extend this list. And see me after this conversation. As you heard, I'm Senior Advisor, Market Development and Partnership. So my main role today is to find more partners, to find more business, and to grow the organization so that we can accommodate more people, more pharmacists to come work with us, and we can offer more healthcare services to our communities and our patients and our clients. So our partners, as Mbao has said, PSK is a very strong and close partner to us. We are currently implementing some projects together, and we are thought partners in some projects together, and we are hoping to also add Strathmore there in the near future. Next slide. So we pride ourselves with 4 unique value propositions, and I won't go so much into detail. A lot of what I'm presenting here today is also available on our website, so feel free to just go into our website. But what I would just like to highlight is that we do have a global perspective, localized in the sense that we are still attached to our global affiliate, and we get a lot of technical and thought partnership in terms of the projects we implement. We put empathy at our core, so with most of our projects before we start implementing, we use something called human-centered design. And this is just to understand where the problem is and to also co-create together with the communities the solution to get better buy-in. Of course, innovation is a big word, and it's been a buzzword for the last few years, so we're focused on that as well. But what is also key is that we look at implementing future-facing solutions, so things that will go beyond now and can be scaled up in the future. Also utilizing technology and supply chain excellency and consistency. Next slide. So we have an approach, as I mentioned, one of them is human-centered design, but the other one is adaptive learning. So as we implement, we kind of get to understand some of the things and do micro adjustments as we go. So we don't necessarily, stick to the plan. We understand what is happening on the ground, and we try to do some adjustments for the best outcomes. We also think of scale and sustainability from the very beginning. And as I mentioned, we are building capacities internally to be able to have the organization sustainable and some of our products and our projects going beyond the project timelines. We have 4 key areas of expertise. One of them is the one I mentioned, market development and partnership. The other one is supply chain. Next slide, please. So we have supply chain, we have monitoring, learning, and evaluation. We also have capacity building. And as I mentioned, I'm heading the market development and partnership domain, which is one of the expertise. Through the next slides, it will just show you some of the things we are doing in terms of supply chain. So we have system design and implementation, quantification, things around focusing and supply planning. We do both for public health and private sector. We look at maturity assessments and strategy, demand and supply planning, inventory management, ELME, LMIS implementations, and customer service engagement. So the product that has been presented by Dr. Ari, who was just before me, was quite interesting, and that is something that we as inSupply would like to see how to partner and expand beyond the 10 counties he spoke about. Next slide. When it comes to monitoring, learning, and evaluation, all things data. So we do data capture, management, analysis, and visualization. We also do assessments and routine monitoring, both within our projects or within projects that we are not currently implementing internally. We also do utilization forecast and traditional MLE services. Next slide. In terms of capacity building, currently we are really focused on all things supply chain and logistics. So we design and develop and deliver supply chain learning experiences. Both can be instructional or blended and virtual learning. And we're looking also to partner with learning organizations, for example, Strathmore. And we've been having conversations with other universities, especially to create more relevance for pharmacists and to create more opportunities for pharmacists. When it comes to market development and partnership, as we think about sustainability, we want to develop robust and innovative future-looking services, both in the public, but more specifically in the private sector. So we've not had a very strong presence in private sector, and private sector, I mean organizations like the pharma, multinational companies, but also other foundations that are looking at improving health outcomes in the communities. We design and create implementing marketing strategies. Maybe for 2 minutes, I'll give an opportunity to one of the pharmacists who's working with us on Marketers Project to just give a quick snapshot of what we are doing with private pharmacies around advanced family planning. And then we also focus on strategic partnerships, so we kind of create an ecosystem for different partners to come together and co-create solutions, all geared towards improving health outcomes. Next slide. I want to speak about just 3 key products, but we do have many other products. This is one of our legacy products that has been seen to work even in arid, semi-arid lands, and that is meaning that these people are probably not very literate, they don't have technology, they don't have internet, but they are products that have been seen to work in that environment. So C-Stock is currently a mobile platform, can be used for both smartphones and also feature phones for community health volunteers, and this has enabled them to get more delegation in terms of product management in the communities because they're able to report back to the facilities. Impact Teams is basically a quality improvement platform where different stakeholders come in to look at where the problems could be in terms of product availability, understocks, overstocks, expiries, and we basically capacity build the different stakeholders through learning packages on how to run those quality improvement meetings. And then learning packages is blended learning provided virtually, so you can do it on the go. We provide it currently for free because it has come out of project, and some of these things we call them as global goods. So currently we don't charge them, but our key focus is to partner with private partners to continue providing them to the general healthcare community. And then some of the things that have also come out of our projects is an AI playbook, which is currently looking at how can we use machine learning to improve healthcare supply chain. So help, for example, pharmacists make faster decision making. So you leave most of the calculations and most of the presentations, the dashboards to the machine, and you have, it gives you kind of the different decisions that you need to make to see that your health facility is running optimally. Next slide. One of our key projects that I think is also very important for this particular forum is workforce development. It's running for the next 5 years, so 2022 to 2027, and we have 5 key objectives. So one of them is to equip health workers with the required technical and behavioral expertise around supply chain. So we've been doing some certain engagements both at national level and county level just to identify what would motivate healthcare professionals to upskill. The second objective is to develop and strengthen operational processes and tools to enhance data equity, data visibility, and real-time data visibility. So this is all around supply chain. So once you equip the healthcare worker, then they're able to use the data tools and the data systems to make decisions and to improve the running of the facilities of their sub-county and their counties. And then the third objective is to look at professionalization of supply chain workers. So one of the key objectives that I would like to hear also coming out of this particular conference is how can pharmacists identify as supply chain professionals, and we have a very clear mandate in terms of levels of practice and standard of practice and career progression for supply chain pharmacists. The fourth thing is to enable inSupply to expand geography and partners. So how can we expand some of the global goods that we are currently creating internally and also co-creating with partners beyond Kenya, Tanzania. So we are looking at also expanding out of Africa, and this is basically to be able to share some of the solutions that we generate as an organization. The fifth one is to enhance subnational level ability to focus, finance, and procure, specifically MNCH product and other medicines. And for this one, we are particularly partnering with partners like ThinkWell around financing, and I forget the other supply chain professional. But we are working in partnership, and we have already engaged some counties like Kakamega and Isiolo, as my colleague Jenny rightly mentioned. I think this is the last slide, and this is sort of aspirational. So we want to separate some of our service offering between public sector and private sector as we think about growing. So for private sector specifically is facilitating market and understanding and helping to navigate the market entry with some of our innovations coming out of our projects, but also facilitating new product introduction. And this is what I would like perhaps Wanjiru Munene to speak about for 2 minutes, if she's in the room. And then mining and analyzing accessible data to develop valuable, actionable insights for organizations. And this is just to say that we have a wealth of information coming from the public health sector. We have a wealth of connections, networks, understanding of the workabilities in the public sector. How can we expand and offer this to the private sector for business efficiency and skill? Thank you very much. If you have any questions, I'm still around. I'll give Wanjiru 2 minutes since we are standing between your lunch.
Hi everyone. My name is Dr. Wanjiru Munene. I am a pharmacist by profession. I have worked, or I have interacted with Wanjiru throughout my career. There are many young pharmacists here, but who, by show of hands, please put up your hand if you consider yourself a young pharmacist. Yeah. Lunch inakuja. Yeah. I want to tell you that there are pharmacists who are pharmacists by choice, have had the gift of the pharmacy profession, and I am one person who is actually very proud to be a pharmacist. So don't give up. I am 12 years in this industry. It's a long journey. I think one of the things I'm going to talk about is my journey to working with inSupply Health. I'm a pharmacist who has worked in the distribution sector. I have worked in regulatory affairs and business development, both at local and regional level. Right now, I am in the business or commercial angle, which has shown me proper character development. And as an opportunistic business, as we were moving our premises, we were able to get into retail. And as we were learning about retail, the opportunity for family planning training came in. And inSupply or PSK had a few people they needed to train. And I remember I forced my way into that training. I remember telling Bao, I will pay for my food. If the issue is food, I will pay for the food. But I'm coming for the training. How have I benefited? If I am to talk about some of the things that have worked for us as a pharmacy, our pharmacy is located in Dumberi. Dumberi is 5 kilometers from Kiambu town, so it's just up the road. It is what you'd call a satellite town. And our focus is on 5 pillars, and I would say our pillars are focused on number 1, access. Access to a community. We serve an older community, or a community that you'd call people who are homeowners or people's shags in that area. So our number 1 focus is to ensure that all these people have access to medicines and to professional services. Our second pillar is focused on offering safe spaces. So our safe spaces are focused on the reproductive health aspect, because we also have a lot of young people who have no reproductive health information, and also mental health. So we have a lot of patients who face a lot of stigma because they have to come for their medication. So our second pillar is focused on offering safe spaces. Our third pillar is focused on education, and that's how inSupply Health comes in, ensuring that number 1, we are educating our patients on their medical treatments, and also keeping abreast with what the community services should be. Number 4 is commercial. Business expertise, business practices in line with the law. Keep learning, don't give up, make your 2 2 shillings, learn what your opportunity cost is, what is the opportunity cost of staying at home versus going and opening a shop in your neighborhood. And number 5 is a commitment to excellence. So when we are working with inSupply Health, we managed to get trained on reproductive health services, number 1. Number 2, we were able to collaborate with them, and now we are working with them to make sure that everyone around the area is aware that there's a daktari in Dumberi who is able to offer full family planning services, and also is able now to work with the CHWs in the area to refer patients and also send out education. So not everyone in the community or in the healthcare space is someone who you need to push away. Yeah. Number 3 is we are working to make sure that we have good referral systems for people who cannot be able to, who we cannot serve but also need the services. So we are working with them to make sure that we have a network of gynecologists, a network of clinical officers who are able to handle gyna issues. For people who need family planning services that we're not able to offer, we are able now to work with them to ensure that they are able to get those services and follow up. Number 4, one of the other things we are able to do with inSupply Health is make sure that through monitoring and evaluation that our supply chain aspect when it comes to family planning is not hindered. So number 1, through data, we are able to call our patients and remind them of their appointments because we are able to keep that data. Number 2, we are able to talk to our suppliers and make sure that if there's a commodity or there's some, keep our ears on the ground, and if there's a commodity that is missing, that we are able to talk to our suppliers or any of our partners to make sure that we always have a good supply of the goods. The other thing that inSupply Health, and I think we are working on in the future, is to make sure that they are able to support us to communicate to our patients. Right now, we are not able to, we are doing it out of our own initiative, but I am sure within inSupply, I have challenged them to have a bulk SMS option where we are able to remind patients when they come for their medication that it's time that you come for your next dose. Another opportunity that has been very good with inSupply Health is that we have been able to interact with very senior officials from the Bill and Melinda Gates Foundation, because they also wanted to understand how this is working in-house, and through that there's a lot of follow-up to make sure that our needs are met. So when you hear of any opportunity, think about it, jump on it, and make full use. Right now, Dr. Wanjiru is here looking for partnerships, and I'm sure I will be one of the people who will be challenging that whole situation. So thank you, Dr. Wanjiru, for offering this to the community pharmacies and basically to Kenyans in general.